Welcome to our deep dive today. We're going to be focusing on Sjögren's syndrome. And this is going to be particularly useful for all you healthcare providers out there.
Absolutely.
It's actually, not a lot of people realize this, but it's the second most common autoimmune rheumatic disease.
Yeah.
And it could really impact a patient's quality of life.
Yeah. So Sjögren's syndrome, it's a chronic autoimmune disease, and it affects what are called the exocrine glands.
Oh, okay.
So these glands, they produce fluids that essentially lubricate different parts of the body.
I see.
So these fluids are, super important for, daily functions like chewing and swallowing and seeing.
Makes sense. So it's the body's own immune system that's attacking these glands.
Exactly. The immune system is attacking these glands. And so what happens is you get a decrease in the production of these fluids.
Uh-huh.
And as a result, patients experience a range of symptoms. The most common ones are dry eyes and dry mouth.
Okay, so dry eyes and dry mouth, that's what we typically think of as Sjögren's. But are there any other symptoms that might be present?
Yeah, so dry eyes and dry mouth, like you said, those are the hallmark symptoms. But Sjögren's can affect other parts of the body as well.
Interesting.
So patients may experience dryness in other areas like the skin, the nose, the vagina.
Oh, wow. Okay.
Fatigue is also really common.
Yeah, fatigue comes up a lot with autoimmune conditions.
It really does. And then some patients also develop joint pain, muscle aches.
So it sounds like the symptoms can really vary from person to person.
Yeah, they can. And this is one of the reasons why diagnosing Sjögren's syndrome can be challenging.
Makes sense.
Because the symptoms can mimic other conditions. And so it makes it really difficult to pinpoint what the underlying cause is.
I want to touch on something you mentioned earlier about the diagnostic challenges. You said it takes an average of 4 years to get a proper diagnosis.
That's right. And this delay in diagnosis can be really frustrating for patients.
So what are some of the conditions that Sjögren's syndrome might be mistaken for?
So the symptoms of Sjögren's syndrome often overlap with those of other conditions like menopause, fibromyalgia, even anxiety.
Oh, wow.
So, for example, dryness could be attributed to hormonal changes during menopause. Fatigue, like we said, could be a symptom of many different conditions.
Right.
And joint pain can be a sign of osteoarthritis.
So it's like trying to solve a puzzle, but the pieces could fit in multiple places.
Yeah, that's a good analogy. And then to complicate matters even further, the diagnostic process itself can be pretty complex. It often involves a combination of different tests, including blood tests, eye exams, and even biopsies.
Speaking of blood tests, are there specific blood markers that are looked for in Sjögren's syndrome?
Yeah, so there are certain antibodies that are often present in the blood of individuals with Sjögren's syndrome.
Yeah.
And these antibodies, they're directed against the body's own tissues, specifically the exocrine glands.
So these antibodies, they can help to confirm the diagnosis?
They can,
Yeah.
but it's important to keep in mind that not everyone with Sjögren's syndrome will have these antibodies. And even if they do, the presence of these antibodies alone isn't enough to make a definitive diagnosis.
So it's really a combination of factors that needs to be considered.
Exactly. Clinicians really need to take into account the patient's medical history, their symptoms, the results of their physical exam, and then also the findings of any laboratory or imaging tests that they've had.
It's a multifaceted approach.
It is.
Now, you mentioned eye exams earlier. What role do those play in diagnosing Sjögren's syndrome?
So eye exams are crucial because dry eye is one of the, like we said, the hallmark symptoms. So during the eye exam, an ophthalmologist's going to assess the tear film, which is the thin layer of fluid that covers the surface of the eye.
Okay.
They're also going to be looking for any signs of damage to the cornea, which is the clear front part of the eye.
Got it.
So the eye exam can reveal both the presence of dry eyes and the severity.
Exactly, yeah.
And then in some cases, a special test called a Schirmer's test might be performed. And this test measures the amount of tears that are produced by the eye.
It sounds like diagnosing Sjögren's syndrome requires a really thorough and comprehensive approach.
It absolutely does. It requires, a high index of suspicion from the clinician.
Right.
Especially when a patient presents with a combination of seemingly unrelated symptoms.
Right. That makes a lot of sense. So this brings us to a crucial question. Who is most at risk for developing Sjögren's syndrome?
So Sjögren's syndrome can affect anyone, but it is much more common in women. In fact, about 9 out of 10 people diagnosed with Sjögren's syndrome are women.
Wow, that's a significant gender disparity. Why do you think that is?
The exact reasons for this gender disparity aren't fully understood.
Uh-huh.
But there are some theories that suggest hormonal factors may play a role.
Interesting. Is there a specific age group that's most commonly affected?
So while Sjögren's syndrome can occur at any age, it is most often diagnosed in women between the ages of 40 and 50. And this is often a time of significant hormonal changes.
Right. So we've established that Sjögren's syndrome is a complex autoimmune disorder that primarily affects women and can be very challenging to diagnose.
It's important to remember that Sjögren's syndrome isn't just about dryness.
Okay.
It's a systemic disease, meaning that it can affect multiple organs and systems throughout the body.
Can you give us some examples of how Sjögren's syndrome might impact other organs?
Yeah. So, for example, dryness in the lungs can lead to a chronic cough and difficulty breathing.
Oh, wow.
And then the involvement of the kidneys can result in kidney problems.
Yeah. So the complications can be quite serious.
They can be, and that's why early diagnosis and proper management are essential. So let's shift our focus now to the management of Sjögren's syndrome.
Okay.
And it's important to note that there's no cure for Sjögren's syndrome.
Right.
But the good news is that there are effective treatments available to manage the symptoms and really help improve quality of life for patients.
So what are some of the treatment options for Sjögren's syndrome?
Well, the treatment approach is really tailored to the individual patient.
Makes sense.
It depends on the severity of their symptoms and which organs are affected.
Can you elaborate on that a bit more?
Sure. So for patients with mild symptoms, over-the-counter remedies like artificial tears and saliva substitutes can provide significant relief.
Okay.
Those can help alleviate the dry eyes and dry mouth.
And what about patients with more severe symptoms? What options are available for them?
So for more severe cases, prescription medications might be necessary.
Okay.
There are medications that can stimulate saliva and tear production.
I see.
And other medications can actually help suppress the immune system, which can reduce inflammation in the affected glands.
That makes sense. Are there any lifestyle modifications that patients can make to help manage their symptoms?
Absolutely. Lifestyle modifications play a crucial role in managing Sjögren's syndrome.
Okay.
So, for example, staying hydrated is essential for everyone, but it's particularly important for individuals with Sjögren's.
Right, because of the dryness.
Exactly. So drinking plenty of water throughout the day can really help combat that dryness. For a patient with Sjögren's, the healthcare team might include a rheumatologist who specializes in autoimmune diseases,
Okay.
an ophthalmologist for dry eye management, a dentist for oral health, and then the primary care physician to kind of coordinate overall care.
That makes sense. It sounds like communication and collaboration among the different specialists are key to providing optimal care.
Absolutely. The goal is to really manage the patient's symptoms holistically and improve their overall well-being. I think the biggest takeaway is to really keep Sjögren's in mind. When a patient presents with a cluster of seemingly unrelated symptoms, especially if those symptoms include fatigue, dryness, joint pain.
Well, thank you so much for joining us on this deep dive into Sjögren's syndrome. We hope you've gained some valuable insights that you can apply in your practice. Until next time, remember, knowledge is power.
Thank you for watching. Please subscribe to our channel by clicking the subscription button. If you have any questions, feel free to leave a comment below in the comments section.